Welcome back. We're currently in the middle of the Medicare annual enrollment period, and our sponsors at Independent Health want to make sure you're choosing the best plan for you. Joining me now is Kathy Aquino to tell us more about it. Hi, Kathy.
Hi,
Thanks
Chelsea.
for joining me.
Thanks for having me.
Of course. So I'll have you start out with the obvious, explaining Medicare annual enrollment period and why this is an important time of year for our community.
Sure. The Medicare annual enrollment period is upon us. Started October 15th and it runs through December 7th. And it's so important because it's that one time a year that our Medicare beneficiaries can choose the plan that they're going to be enrolled in for next year.
Okay. So there have been some significant changes to Medicare Advantage plans, right?
Yes, definitely. So every year there's changes, but what happened is in 2022, the Inflation Reduction Act started being phased in. And over the last 2 years, then there's been some changes, but the most significant change is happening for next year. And what that is around is the Medicare Part D prescription cost sharing for our Medicare beneficiaries. So how it's going to work is when a Medicare beneficiary spends $2,000, Chelsea, out of their pocket, any cost thereafter, the health plan has to assume all additional prescription costs. So it's a win-win for our Medicare beneficiaries. They don't pay anything thereafter. So this year, it's more important than ever, even if you like the plan you're enrolled in, to talk to someone and understand what these impacts are going to look like for your prescription for next year.
That's right. And this is going to be changes that are going to be sweeping the nation.
Across the country. So when the significant change for next year came into play, the health plans had to decide how they were going to set up what's called their drug formulary. So what that means, a drug formulary, it tells you what tier your prescription drug is going to be on. Tiers 1 and 2, 1 is usually generic drugs, you pay nothing. Tier 2 is a small co-payment or co-insurance, but it's really going to be about tiers 3, 4, and 5 for next year, Chelsea. That's where your more expensive drugs will land on the plan's formulary. And then when you sit down with someone, they can tell you what your costs are going to be in those tiers and how these changes are going to impact you again for next year.
Well, speaking of that, Kathy, let's talk about how Independent Health is planning to assist Western New Yorkers in selecting those Medicare Advantage plans, because it can feel overwhelming, right?
It can be. And I think every year we come out and we talk to our Medicare beneficiaries here in Western New York, and we say it's that time of year. Well, this year, again, more than ever because of the changes I just explained, the local red shirts, because we're the local health plan here in Western New York, are ready to meet with people individually. We do a personalized one-on-one benefit review to, again, talk through what are your needs going to be for next year and make sure you enroll in the right plan.
Nice. So what can people expect from Independent Health's Medicare Advantage plan in 2025?
Sure. Next year, we're definitely going to be continuing to offer a variety of Medicare Advantage plans, and I guarantee we have a plan for everyone. Next year, we have a new $0 plan and a new PPO plan. So we definitely want to talk to people about what those plans look like so we can see if it's something they need to be enrolled in. And we will continue to offer our popular Silver Sneakers fitness program.
Oh, yeah.
And seniors are really, they love this. And it actually allows them programming that they can go to the gym and take classes. But the biggest thing it offers them, opens them up to thousands of gyms across the country. So a lot of seniors have a gym here in Western New York. They go on vacation or they go visit their family. They find a gym there, and they're so healthy. They're picking gyms and they're working out when they're not even here in Buffalo. So Silver Sneakers is at no cost to our Medicare members at Independent Health.
Oh, my grandma, Patricia Glover,
loves
loves Silver Sneakers. She goes to all the gyms around her area, and she takes her water aerobics
they
here,
do different gyms.
Zumba here. She loves it.
She's awesome.
Yeah,
I love it.
no, she's having a lot of fun.
Good.
So talk to us a little bit more about when's the right time to call and find out you know, what the best plan is for you.
Sure. So we have 5 permanent year-round Medicare information centers that are open here in Western New York. They're located in Depew, Orchard Park, Williamsville, Tonawanda, Jamestown, and then we have red shirts in Niagara County on certain days and times, and also in Olean and Dunkirk. But if they can't get in, they want to get questions answered first, our call center with staffed with red shirts are open 7 days a week, 8 a.m. to 8 p.m. So sometimes people want to call first, get some questions answered, then come in with their list of prescriptions and all their questions into one of the Medicare information centers.
Nice.
Yeah.
And Kathy, who is eligible for this open enrollment period?
Yeah, traditionally it's individuals who are over the age 65 and older, and you have to be receiving Medicare Parts A and B through Social Security. Some individuals are under 65 due to disability, so that's all qualified through Social Security. So those are the Medicare beneficiaries. When I say that, those are the individuals we're talking to, and they're all getting mail right now, right? So you're getting mail from your current carrier, and all the other health plans are also sending mail. So at the end of the day, you need to sit down, I can't stress enough, with someone, with your health insurance carrier. And we have people shopping right now. They may be in one plan, but they're coming in to visit with the red shirts to just do their price comparison. And they are really detailed. They come in with their notes and they have all their questions. We love it. And then again, we can assess, make sure we have the right plan for them. And if so, we can do the transaction and complete the paperwork.
All righty.
Yeah.
Abby, thank you so much for coming in and sharing
Awesome.
more about this. Viewers, if you would like to learn more about our sponsors at Independent Health's Medicare enrollment at independenthealth.com/Medicare, or you can call them at 716-635-4900.